am Tia Maragos. I'm a principal with Andrew James Advisory Group. My background is in healthcare. I've been in healthcare for over 20 years, both on the provider side and the medical device side. I have my master's in healthcare administration as well as my MBA. Have seen all sorts of healthcare on the provider side, been involved with flow and throughput, re-engineering the departments, et cetera, from finance, from the patient floors, and of course, as we're going to speak here, asset optimization and asset management. So it's my pleasure to be your host of this workshop here. I would like to say it's a workshop because we like to hear from you and your questions, because a lot of times we don't talk about asset optimization and asset management within healthcare. And you'll find from our panelists here that it is an important thing to have in our back pocket as healthcare leaders. And it's something that's very, very important and sometimes overlooked. You will hear from a number of people with various backgrounds. What I love about this is that you're going to hear from both for-profit and not-for-profit, as well as government places within healthcare facilities. And you'll hear a variation of on a theme, quite frankly, because ISO 55000, 55001 and 2 is very, very important. So really, what we're going through today is the following. We're going to take you through what is ISO 55001 and 2 for those of you who haven't heard about 55001 and 2 and what are the benefits. And then we're going to take a look at a deep dive look at University Health System in San Antonio. Michael is going to give us a background to help you understand the backdrop of the system in San Antonio, where we have ISO 55001 certified by an outside certifying body, which is very important. And then Art and Ed and Frank are going to really talk about how to strategically support this initiative within the hospital, because it's extraordinarily difficult. And finally, we're going to wrap up with, what are the next steps? If you wanted to do this within your organization, what would that look like? And then talk about the training and certification opportunities. And in the meantime, we're going to have, hopefully there's a the chat box is open. So if you have any questions, Nick will be looking at those and making sure that we're answering all of your questions. So really, what is ISO 55000 and 55001 and 2? It's an international standard for asset management. Of course, it was disseminated by the ISO and based on international consensus. And really, we're talking about 3 different sections. And it's important to really look at the different sections and understand the differences of them. The ISO 55000 itself is the overview, principles, and terminology. And really, that gives you, I would say, the vernacular, if you would, the definitions, how we as an international body will look at what those principles and terminology mean. So it's really giving you the dictionary of ISO 55000. 55001 is actually the requirements. So there are a lot of shall statements. Now, when you're reading the shall statements, it actually means must. You must do this in order to be ISO 55001 certified within your organization. And then ISO 55002 are really those guidelines in order to achieve, and the best practices in order to achieve 55001. Now, as you can see from the slides, it started approximately in 2014, but many organizations worldwide were trying to solve this problem individually. And really, quite frankly, we're working on this problem. It was just in 2014 where we all came together and decided on this international standard and came to, okay, here's what it looks like. And as an example, we're going to kind of delve into what ISO 55001 or what ISO 55000 is and is not. It really does not deal directly with maintenance, reliability, and engineering. It is strategic and it's not and tactical, but not operational. It's a top-down, end-to-end, holistic approach. What it really does is take you up to the 30,000 foot level and ensures that within your organization's goals and objectives from the highest level trickle down and make sure that everything ties to it. So what is going on with your assets and your asset decision making and the life cycle of your assets, et cetera, your purchasing decisions, all of those things must tie to the overall goals and objectives of the organization. There's a lot of benefits to ISO 55000, and actually the benefits that we've seen, these are the benefits that we've seen in organizations that have actually implemented ISO 55000 and ISO 55001, utilizing ISO 55002. These are the ones that have actually been certified. So it's not necessarily just healthcare. We're talking about all of those organizations within around the world that have actually been certified by an outside body. And we've seen it's been verified. There's been improved financial performance, and the investment decisions within the assets are much more informed and aligned with the overall goals and objectives. And really managing the risk has been very, very important. And quite frankly, it's very important because it not only allows you to, from a financial perspective, it allows a lot of people, and it has been shown that it's helped the bond ratings, it helps insurance premiums, et cetera. But for specific to healthcare, it manages that patient safety risk a lot of the times that you will see. So just a big picture of ISO 55001 and 2 in practice circa 2010. If you are familiar with General Electric healthcare, GE healthcare, that's where I came from, and I was part of a team that actually formed the asset optimization practice within GE healthcare, utilizing essentially the GE's management objectives and the way that you would align your programs to your overall organizational goals. So, so really, this is just kind of a proof point showing that, yes, there were a ton of organizations throughout the world trying to do this in bubbles, if you would. And now it's available to everyone to get in the same, to be able to go to the same standard, to be able to, at the end of the day, look at ISO 55000, implement it with ISO 55001, and get certified. In this case, this was a hospital, a health system in New York City. There were a lot of problems there. They wanted to buy too many pieces of mobile medical equipment, probably about 50% more than they actually needed. They were not circulating their assets. They were getting the assets, the mobile medical equipment were getting cleaned about 9% of the time. This is why I'm not telling you which system it is. 9% of the time, the assets were actually being cleaned. And quite frankly, there were assets that were leaving the facility. And so they needed to get a hold of this. They needed to reduce their operating expense by 5% annually because it was going through the roof, because they had so much, not only did they have so much loss, but then they also had too much equipment that they couldn't find. And then there were a lot of old, as we like to call in healthcare, big iron that was sitting there in the radiology department that really could, you could actually close down some rooms and not need to buy, for example, another MR. And there quite frankly, there wasn't any standardization throughout that organization. So as you can see here, this is circa 2010. Now we have something called ISO 55001 and 2, who is able to, that's able, it's a methodology that's able to lend us um, to all of the healthcare systems and all industry, in fact, in order for us to be able to really align our asset management strategy to the goals and objectives of the organization.